This is the Forbes Books Podcast, conversations with remarkable folks who are impacting the world of business and beyond. Hola, I'm Joe Pardavila, and my guest this week is Dr. Hassan Tetteh, a true pioneer in the field of artificial intelligence and healthcare. As a world-renowned cardiac surgeon, he has witnessed firsthand how AI and machine learning are revolutionizing medicine. In addition to his clinical work, Dr. Tetteh is a widely published author and acclaimed speaker. Coincidentally, he just gave a talk at the American College of Surgeons where he spoke about better surgical care through artificial intelligence, and we'll get into that a bit later. We're also going to get into his vision for how the healthcare industry can implement these powerful technologies thoughtfully and ethically. Doctor, how are you, sir?
I'm doing great, Joe. How are you?
I'm doing good. And so we're going to talk about AI, and it's funny because many people have said that artificial intelligence is going to change lives, but in your mind, you think AI is going to save lives. So before we make the jump to AI, though, Doc, let's talk about the current state of technology in healthcare. Forgive me if I get this wrong, but currently we are using something called EMRs or EHRs, electronic health records, right?
The electronic medical record or the electronic health record, yes.
Yeah, I know it's been interchangeable. So right now, for patients, that's where our information lives. And
Correct.
Now, how will AI play a part with that acronym soup that we just talked about? Like, how will AI connect with that to help us going forward? Because I know we have privacy laws and HIPAA rules. How are we going to share information to AI without violating people's, trust?
Yeah, good question. I think there's a couple layers to that. So we can answer the question about how will EHRs, electronic health records, electronic medical records, fundamentally impact this era that we're living in of digital health. I mean, by definition, the very fact that the ONC, the Office of the National Coordinator, formulated the High-Tech Act, which is the policy act that mandated that electronic records need to be the medium by which patient care is documented. So that happened several years ago. And what that did is it ushered in an era where all essential healthcare systems, anyone providing care, had to have an electronic health record that documented the patient's care, sort of memorializing their journey, if you will, in an electronic format. Now, what that did is it ushered in this era of digital health. And what I mean by that is prior to that, and I can remember practicing in the era when we wrote notes on the paper, you needed sometimes some hieroglyphic decipherer to figure out what kind of handwriting the doctor had. And that's where the doctors got the reputation for bad handwriting, because we would scribble a note and, you had to figure out what the doctor was trying to convey. But in this new sort of place that we're at, where we find ourselves having this electronic database, a repository of information, now you can actually utilize the tools that we have to sort of gather that data, curate that data, synthesize it, and then, of course, create models and build algorithms on that information. The privacy part that you ask about is very important. And the way to think about that is severalfold. Certainly, there could be a data breach where your electronic health information is exposed or it leaks, and you have guidelines and there are rules in place that if this does happen in an organization, the patients and those impacted by this breach are supposed to be notified. With respect to using it for AI and for the purposes of building algorithms and using the information to develop insight, if you will, there's lots of ways you can safeguard the privacy of the patient. You can de-identify the data, especially if you're doing sort of large aggregate kind of studies, or if you're using perhaps imaging, which is also used to do computer vision and make diagnoses on radiographic films. You don't need to have the patient's information. So, Joe, we don't need to have your name associated with the image for us to take the image, use the image as a basis and a building block for developing algorithms that can help us with diagnostics and therapeutics. So there are ways to safeguard the privacy and to protect the information. But at the same time, what's really exciting about this time and this era that you identified as the digital health era is that we have a large amount of information. We're gathering this information minute by minute, second by second, hour by hour. And all of that information can potentially be used to develop some enhanced tools to help us do the work of delivering better healthcare.
Nice. And one last thing on EHRs, Doc. You mentioned the fact that we will be able to sort of strip the names of folks and then apply all of that data into an algorithm. Are we ready for that right now? Like, are we able to, for lack of a better word, encrypt all of this information that's been collected over the last several years that EHRs have been in effect to then go ahead, take my name off it, take your name off it, feed the algorithm, and then the artificial intelligence will create either programs, treatments, or what have you with this information. Are we there yet?
We are, yeah, we are there. Absolutely. My team and I wrote about this kind of process and how you could go about de-identifying the information. In the case that I cited in radiography, you can do that for sure. You can do that in pathology. You can do that with the medical records as well. And you have to structure the data and use that structured data as a means for, the building blocks and the basis for developing the algorithms. So yes, we're already there. We absolutely are here. It's happening. There are already even algorithms that are being vetted through the Food and Drug Administration to be used in actual patient care. And some of the first of those models, is what we call them, have been already approved through the Food and Drug Administration. So yes.
Interesting. Okay, cool. Good to know. And one of the dirty little secrets about the medicine and healthcare in general is how slow they've been to digitize. The EHRs are a great example of it. I mean, the fact that we've had the ability to have electronic records for years, and yet this is a pretty new occurrence. And now you throw AI into this soup. How is the industry handling that? Are they, again, going to, let's take our time, let's not rush into anything just yet? Or have they recognized the errors of their way and be like, okay, cool, we have to get on this rather quickly?
Yeah, that's a great question, Joe. I think a couple things are happening, right? I think that you are right in your assessment that the health field in general moves sort of slow. It's a very conservative sort of culture, right? And particularly when physicians, doctors, institutions have what they perceive works. So, hey, we've been doing this like this for years. It works. I started doing this when I left medical school 20 years ago. It works. My patients seem happy. I don't think I see a need to change. So there's just an embedded conservatism, right? And there's also, great risk in trying to introduce something new that's unproven, that you don't know about, especially if you don't have a lot of experience. So I think there's just a, healthy superstition and I think a culture of conservatism in medicine writ large. So break. Having said that, a lot of things are happening. There's sort of a convergence of super forces that are sort of pressing on the culture, pressing on the system, and actually impacting what's happening on the ground. So you mentioned we are moving slow, but we're also moving very fast. And what I mean by that is I like to, often say the AI revolution in healthcare is not coming, it's here. And why is that? It is here. It's here because, industry is not going to, and the market forces are not going to necessarily wait for the doctors and the health systems and so forth to catch up, because like most markets, they recognize that they're forces, right? Supply, demand, needs versus no needs, developing wants, and sometimes there's that developing desire when, patients or consumers in this case don't necessarily think they need something. Well, who would have known that we needed that carry around a supercomputer in our pockets?
Right.
You told me that 30 years ago I was going to be carrying around a computer that I could use to take pictures. I could use it to make phone calls. I can keep notes on it. I could write papers on it. I could do all this stuff. I would have said, I don't think I need that. I have all of these things. And,
right.
I don't think so again, if you think about that sort of example in respect to health, the perfect example, I think, came during our pandemic. I think people realized very quickly that, I don't necessarily need to go sit in the doctor's office, wait there for hours to see this one individual to get a very simple question answered or to get a script prescribed or, in fact, to get real insight into what's ailing me and what's happening. I could actually log into my computer and have what we call now a televisit, right? And now telehealth is now sort of a lot more acceptable. It seems like it's a lot more comfortable. Physicians are comfortable with it, and they see a great number of efficiencies built into something like that. The patient doesn't have to get in their car, drive to this institution, struggle to find parking, and then, spend the next half hour, 20 minutes huffing and puffing trying to find where this doctor's office is. They simply can just log in or just, open up their phone and just start chatting away and get what they need and very conveniently in a few minutes have their problem issue or problem addressed. So I think this digital health revolution is already happening, right? And who facilitated a lot of that? It wasn't the doctors, I could tell you that. It wasn't my colleagues sitting around saying, hey, we should go build a computer and figure out a way to have an interface. No, it was people recognizing there was a need in the market at a time when people were, hunkered down and they couldn't move and mobilize, but yet needed to still have this interaction, this engagement with the health system. And they figured out a way to do that. And they also figured out a way to integrate all of the elements that we need and tools that we need to deliver good care. Can we get the diagnostics? Can we order tests? Yes, we can do all of those things, and we can do it virtually. You don't have to have the person physically, in front of you. So the digital revolution, as I like to say, is upon us. It's coming. And yes, medicine is conservative and it's slow, but there are market forces as well as patients and consumers that are going to drive it even faster. And what I referenced before, these super forces, I think is really important to highlight what those super forces are. You can think of them as in sort of big buckets. One of them is there's a large amount of computer power that we have now, right? That I keep going back to the phone, much more powerful than it was years ago. We have a lot of data. A lot of that data is coming from those electronic health records you asked about earlier. We have this ample sort of repository of information that we can draw upon that can be used to develop algorithms and to feed and train models so that we can get better and better at AI or applications that use AI. We have huge amounts of government as well as commercial investments, right? Decades ago, the government wasn't pouring billions of dollars, and certainly we didn't have these big companies like Apple, Microsoft, Facebook, etc., pouring billions of dollars into all of this sort of technology. We also have really good models now, and we have these models that are available, these algorithms that are open source, so people can use them, they can apply them, and they're getting better and better by the day. And we've also proven that you can even use AI to build even better models. And then finally, we have people, right? And I say people are probably the fifth and probably the most powerful super force, because they're pushing technology, they're pushing innovation, they're driving change. But on the other side, you have these consumers, you have these patients and even physicians for that matter, that want things to get better. We have a very fragmented healthcare system, and I think we have seen an opportunity to use and leverage this technology to create a better system, a more equitable system, hopefully and ideally, and a more efficient system so that people can get the care that they need in a little bit better way than had been done in the past.
Sweet. And so there's sort of a three-legged stool to how AI is going to affect the healthcare industry. There's prevent, diagnose, treat. So if you don't mind, let's break those down real quick. And as you can tell, Doc, I'm not as an educated person. So let's try to speak in layman's terms here. So prevent. How will AI help prevent disease or infections?
Good question. I think there's lots of ways that it can be used to help prevent disease. And, it's interesting you use prevent, treat, and diagnose. I was asked this question at the press conference that we just talked about. I grouped them into three categories that are pretty much, aligned in the same. And I said AI is going to make the biggest impact in diagnostics, workflow, in therapeutics. So prevention, you said treatment. Yeah, and you said diagnostics. So I think when you talk about the diagnostics, I'll give you a macro example, a big example of something that we used, and we applied AI to help us with diagnosis and prevention to some extent. We had an opportunity during the height of the pandemic, very early on, before people really had a handle what was going on, but recognized that there were lots of people coming to the hospital and entering into the sort of healthcare system with fever, cold, flu-like symptoms, essentially, right? And there seemed to be that folks that were a little bit older had a little bit more morbidity when it came to COVID. So we used claims data from Medicare to sort of play a little bit of Sherlock Holmes. And that claims data at the time, early claims data, and this is from CMS, we coordinated cooperation of getting that information and that data accessible to us to build models. So when people were presenting to the hospitals, invariably the hospitals would write a claim and say, this patient came in with flu-like symptoms. We didn't have an ICD-10, which is the code that you use for a particular disease for COVID at that time, but people had flu-like symptoms. That was very apparent. And then we could track this across the country, and we could see where these patients were engaging with the health system. And then what we did is we built models to sort of predict and give us information and insight as to where the outbreaks were occurring. So we could sort of project, hey, over time, lots of people from a particular zip code level were coming in, engaging with the system. And we used that to inform, at the time, some of our public health officials so that they could deploy resources to those areas, because they would be able to get ahead of some of these outbreaks and some of these surges in COVID. Now, that was a good way to sort of, help with prevention, right? Because if you could tell where there was a large
Spike,
nucleus and concentration, spike, if you will, let's get down there. Let's get protective personal equipment, the PPE stuff. Let's get doctors, let's get physicians, let's deploy nurses down there. Let's get those folks treated. Let's get them quarantined. Let's find out where their contacts are and try and contain that. So that's both a prevention and a diagnostic example. As far as the therapeutics are concerned, it's very well known now that drug companies are using AI to sort of accelerate their drug trials, building sort of predictions to see what side effects, what outcomes would happen with a particular drug, especially those that are sort of still in development. And so that could potentially accelerate the come to market or the bring to market of therapeutics, which I think could be really important. I think there's going to be a lot more of that kind of use of this AI technology to accelerate the bringing of products, drugs, and therapeutics to the market to potentially help patients when they're in need.
Interesting. So the one thing I'm concerned about is the fact that these AIs, they hallucinate. Folks not familiar with the term, hallucination basically means an AI program makes crap up. Famously, there was that AI lawyer. The lawyer wrote up a brief and had the AI write up the whole case for him, and it turned out the AI just started making up cases, and the guy ended up getting in a lot of trouble. So how do we handle hallucinations when it comes to how AI works into the healthcare space? I mean, obviously, hopefully, a doctor's not going to just go to ChatGPT and ask for a treatment from the AI model. But talk about hallucinations and how that will affect or slow down the way AI works in healthcare.
Yeah, that's a great question. I think you identified certainly a problem and a limitation of this technology, right? And this is particularly true in those large language models. That's what the basis of the ChatGPT platform is. And you have to understand that sort of hallucination was really a result of a very well-written code. The code was produce an answer for a question. So that was, simply the technology, the algorithm doing what it was told to do. Whether or not it was a hallucination or bringing sort of aberrant facts was really a consequence of the fact that it was pulling from information that was available to the model.
Right.
And the models have to be trained, and they have to be validated, and they have to be improved upon and updated as time goes on. Otherwise, they can, as you said, hallucinate or give you erroneous information. So when it comes to healthcare, though, I should give you some assurances that particularly for those algorithms and those solutions, those applications that were vetted through the FDA, there's a lot of information that has to be validated in terms of where's the data coming from, right? How are the models developed, and how are the models tested over time? So we do something called testing and validation with models before we deploy them, ideally, particularly when they're going to be in an environment where, harm could be imposed on a patient. or when care is going to be delivered. And in those cases, the data and where the information is coming from has to be really, really scrutinized. So I think there's some assurances there that you could have less hallucinations, if you will, or less likelihood of that happening. So that's a good thing. The other thing is, this testing and validation is going to be particularly important in the scope and in the realm of healthcare, because the models are going to have to be subject to a lot of, sort of fidelity checking, and then making sure that they're durable, they're standing the test of time, and where the data is coming from has a high degree of accuracy and validity.
Good stuff. And I mentioned it, you mentioned briefly there, you did a press conference titled Better Surgical Care Through Artificial Intelligence. And now someone randomly picking that article up online and be like, whoa, wait a minute, the AI is going to be doing surgery? So give us a little thumbnail of how there will be better surgery with AI.
So that's a great question. That very question came up during the press conference, and one of our colleagues who works in that space gave an answer that I think addresses the concern that you just raised. We do have AI in the operating room now, and I like to point out that artificial intelligence is an ever-evolving subject, meaning what we defined as AI years ago is going to continue to change and morph and evolve. And there was a time when washing machines were considered a robot, right? And some people, strictly speaking, can still say a washing machine is a robot. And is that artificial intelligence? Perhaps. But we have robotic surgery that's being performed, and it allows us to be able to work in very small spaces because we have the arms that have this sort of the dexterity that you couldn't really achieve if you had to open the patient up and get inside with your hands. The space is just too small. These arms, these robotic technologies are helping us out. So is AI technically in the surgical suite? Perhaps, if you use that as the definition. But is there some autonomous being or some sentient being that's in the OR operating without the surgeon? No, that has not happened. I doubt that that's going to happen anytime soon. The other example that a lot of people like to point out is that we have autopilot, as you know. Airplanes can take off and land and fly technically without an individual being there, but we always have a pilot there just in case something goes wrong. So I think we're not quite there with this autonomous type of modality for surgery, but we are having the ability and the opportunity to use these great tools that are enhancing the surgeon's ability to perform what they do. And I think that's going to continue to mature and develop and evolve over time. But yeah, better outcomes with AI in surgery is definitely a large umbrella of a number of applications that we talked about. What we were really focusing on in the press conference was highlighting the work of a few of my colleagues that are real leaders, experts in this field and domain, and highlighting what the art of the possible is, talking about what's the state of the art in AI and artificial intelligence surgery, and also what can be done right now, and of course what some of the limitations are, and giving our colleagues an opportunity to ask questions and also to sort of, I think, plant some seeds for discussion and give us some plans and some opportunities to see where where we can apply some of these expertise to keep making things better for our patients.
And I know you're a scientist and a doctor, but I'd love to get your take on the future in terms of the C word. Since I was a little kid, cancer has always been talked about of one day there's going to be a cure. One day there's going to be a cure. And I know treatments have come a long way. Me as a card-carrying Gen Xer have changed a lot since the 80s and now it's 2023. Can AI play a role in the end game of cancer?
Perhaps, yeah. I think that's not a far-fetched thought or even an idea to have or entertain. I think what we have to always perceive AI as is a tool to help us do our work better. And this example is always pointed out, and you can see this in your everyday life when you use AI right now to some extent. Whether it be the search engine that Google has or you've been playing with ChatGPT. It's really fascinating, right, that you could have all of the information that the model is able to access and tap be synthesized to answer a question. So it's literally and physically impossible for those of us in healthcare to keep up to date with all of the available studies. I mean, there's research papers being published, many dozens, if not hundreds, have been published while we were here just talking. I can't know all of that new information, but you can use the tools and the search engines and AI to help synthesize through some of that information to help make better connections. So I think that'll accelerate the efficiency of care for patients. And I think it'll also make it possible for us to maybe one day realize a cure for cancer and maybe other diseases as well.
When I speak to physicians, one of the common complaints I get from them is, first is the random requests they get for treatment while they're at, online at the Burger King. But the second is the amount of mundane tasks that a physician has to do every day. A lot of paperwork, and obviously it's gotten a little, I would assume with the electronic health records, it's gotten a little easier, maybe, not sure. You probably could tell me better than that. But how will AI play a role in that for physicians? Because I feel like that has been a choke point for doctors for years now, that they say, a lot of them, it could be a hyperbole, but they say, I spend half my time doing paperwork and then the other half with actual patients. So how about that? How about AI in terms of lessening the load for doctors?
Yeah, that's a great question too, Joe. That's why I kind of used those three categories, as I mentioned, that were very aligned with what you were asking about. And I said, the AI, I think, will make the biggest difference and the biggest impact, at least in the near term, in these three areas of, diagnostics, workflow. Workflow is the key the key what we're talking about here, right? These mundane tasks, helping physicians become more efficient, and then in the therapeutics part. So let's talk about the workflow. So imagine when you go see a doctor, and if you've seen one lately, you know that there's invariably question and answering, trying to get a sense of why you're here, what your presentation is, what your problems are. And then, you may notice that we're inputting information into the computer, and we're doing that every time for every patient. We're putting in their blood pressure, we're putting in their heart rate, we're putting in their vital signs, their temperature. Well, imagine if we just put a sensor on and that just automatically captures that information and puts it into the chart. So now no one has to physically, what we call hand jam that in. And that, so now that could be one task that now eliminates and frees up time for me and you to now have a conversation. If they'll alert maybe come up that says, hey, Joe has a fever. All right, let me address that. Joe's blood pressure is a little low or a little high. It's outside of normal. Let me address that. But if it's fine, then, we keep continuing our conversation. Now you think about the next sort of bottleneck, right? Like you said, your doctor friends and colleagues will say, I spend half my time seeing a patient and talking to Joe, but then I spend the other time, sort of ignoring Joe to some extent, and I'm typing in the computer what he just told me. Well, let's take a technology that certainly exists already, and let's say we're recording all of this information. Let's say we're just recording our conversation, our patient-doctor conversation, or our encounter, right? And there is a sensor, is a recorder. We've already got your blood pressure, your vital signs. We've got all of that already. And now there's something recording our conversation. And now let's apply some algorithms and some pattern recognition. So you're going to say some key things. I may say some key things. And at the end of our conversation, I haven't typed the thing. But now there's a dictated note that documents our encounter. Maybe there were some triggers that were set along the way, and we have some nice, carefully placed algorithms and models that we've developed to say, he mentioned that he has pain, he has a sore throat, he's got this. This could be part of a differential of maybe a flu or a cold, and that'll be part of the plan, and then there may be a trigger for other tests to be performed. Do you need an x-ray? Do we need a strep throat test? Do we need to find out if you have strep throat? So I think those are the ways that I think you'll see improvements in workflow. That's going to take time, right? That's going to take the collaboration of scientists, engineers, the doctor, and in some cases, the patient as well. So they're all participating in this to sort of improve and streamline the workflow. But I think we're going to get there because the demand for that is going to be, so intense. Is if you go and have an experience where the doctor didn't ignore you, He spoke to you or she spoke to you the whole time. You really felt like you came away with insight into what was wrong with you. And you had a deliverable, whether it be a prescription, another test, a referral, to get you the help that you needed. And it all happened in a way that was caring, in a way that was unintrusive, and in a way that made you feel like, wow, this person really spent a lot of time with me. And the technology was sort of in the background. It wasn't in my face, and this screen wasn't between me and my provider. You're going to say, that was one of the best experiences I've ever had. I'm not going back to the old way. And that's what I think will happen. And that's how these behaviors and I think some of the workflow is going to start to evolve.
And speaking of behaviors, you are obviously an early adopter in AI. It's clear. But there were also early adopters of telemedicine. There were folks who were doing telemedicine visits before 2020. It was around. It wasn't like something that they invented during March of 2020. And then obviously the pandemic accelerated it.
Yeah.
Will it take a cataclysmic event, a black swan event? Will it take something catastrophic for AI to make a huge impact in medicine? Or are there a lot of Dr. Tettehs out there that are embracing this and are going to introduce it faster? Or will it take, like I said, a horrible event or something cataclysmic for it to become basically just sort of like the old school thermometer in a doctor's office? What's your take on that?
Well, I have a lot of thoughts on that. I would tell you, Joe, I hope not. I guess that's my short answer to your question.
Good.
I hope not. But history would tell us it does take a long time for us in medicine and healthcare to embrace new things, especially new things that absolutely work. I'll give you a couple of examples. You talked about telemedicine. I couldn't help but chuckle. I give a talk sometimes that I love to give, and it's sort of on the future of healthcare. And I gave this well before the pandemic. But I found this picture, and it's a throwback from 1924, and it's called the Doctor and a Radio. So back then, there's a radio, not even a television at the time, and there's a cartoon of the depiction of this doctor coming out of the radio with his stethoscope. And the child is there in the living room listening to the radio, but the doctor's engaging with them. So, even back then, 1924, this concept of let's reach out and deliver the care that's needed from a far distance through the airways. So it's not a foreign concept. So you're absolutely right. This has been around for a long time, but what happened during COVID accelerated things for sure. But then if the critical thing was that there were policies in place, we made it possible to get reimbursed for that care. So that was a huge game changer right there.
Got it.
We made it possible for the rules and the regulations to sort of be adapted for telemedicine, because if you're in another state before, some of these rules were sort of modified. I have a doctor's license in Minnesota, my patient's in New York. Technically, you're not supposed to be able to administer or render care. So some of those things needed to be adjusted and adjudicated. So there's that. But I can't help also say, historically, we have these examples of how long it takes for us to adopt good practices. For instance, Linnaeus, the inventor Linnaeus, he invented the stethoscope years before it was adopted. Now, you see a stethoscope, and it's like the symbolic, iconic item of a doctor, right? You see you see a stethoscope around the person's neck. That guy or that gal has to be a doctor. Well, when Linnaeus introduced this device, which was a really novel, very cool thing, which was very helpful, because before that, the doctors used to take their ear and put it right to the chest.
Very accurate. Very accurate.
Well, over time, perhaps some of the doctors had a very good and astute ear. Yeah. But you can tell how that's embarrassing, especially if it's a man trying to listen to a woman's chest there. And it's a little awkward. And absolutely probably not as good as the stethoscope. Well, Linnaeus introduced this device, pretty novel. Obviously, it worked. It showed and demonstrated great promise. It took decades before people adopted it.
Wow.
As regular practice. Even more graphic of an example, literally and figuratively, was surgeons. A perfect example. I'm wearing this. So this you see this buttons that you have on your jacket here?
Yeah.
This is actually called the surgeon's cuff, because the surgeons in the day used to roll up their cuff like this and go operate. Didn't wash their hands, by the way. They just went in,
Sure.
operated, and they came out, wiped their hands on their clothes, and then went in and did the other case. Didn't wash hands in between. So a British surgeon named Dr. Lister introduced this concept of bacteria and saying that, hey, there was something that was microscopic, we couldn't see to the naked eye, that was transmitting disease in surgery. And what we need to do is we needed to be antiseptic.
Wow.
Between our cases and before cases. That's where the whole concept of sterilization came in. Washing your hands was now trying to be, sort of advocated for by Dr. Lister, Listerine. That's kind of where that comes from. This whole antisepsis idea was propagated by this, by this scientist. It took decades before people said, oh yeah, we should probably wash our hands.
Wow.
So that it just takes a long time, Joe, for, good ideas to sort of permeate and sort of change the behavior, right? Getting back to the essential question, change the behavior of our medical professionals. But I think what happens and what is happening now is there's an acceleration of that adoption. And you can see it, and we're seeing it now. And I think, again, if you go back to those 5 super forces that I mentioned, massive computer power, lots of data, huge investments, a cadre of really talented people and really good algorithms, I think that's going to come together to really give us, somewhat of the perfect storm to sort of accelerate the adoption of this. And there is no mistake, and probably more so now than perhaps decades ago, and certainly before the last century, where there's a lot more, for good, bad, or indifferent, a lot more commercial interest in healthcare.
Yeah.
One, because people see there's lots of opportunity to make money, but it's also a good opportunity to help people, especially those that are not getting help very well right now. And I think that market force is going to be a big driver for accelerating the adoption and changing the behavior of those in the health space.
All right. Lastly, I teased you for being an early adopter. We've kind of made fun of the healthcare industry for being so slow to react to things. But why were you not slow to react to AI? Why are you so passionate about this? Why is this such a big part of your life now? Because you've been practicing medicine for a long time and long before people knew what ChatGPT was. So why is it important for you to get the message across about smarter healthcare with AI? What was it? Was there a aha moment for you that didn't take decades for you to understand the importance of it? What was that? What was that moment for you?
So I would like to answer that question with just one simple word, and then I'll elaborate on it, and that is curiosity. So I've always been a very curious person, and it was probably my father who instilled in me this idea and this thought process of like always making sure that you're looking around the world to see what's happening. And one of my favorite things to read is actually the Wall Street Journal, which obviously not a medical, it's not a medical periodical. It talks about, investments and so forth. But I learned a lot about what's going on in the world by reading that, and just because of market forces and things like that. And even during COVID, I saw back months before it was declared, by the WHO as a pandemic, early in 2019, late in 2019, like the front page and the above and below the fold, for months there was something about COVID, and I said, this is really serious. A lot of it was happening in Asia and overseas, of course. So it was just sort of an early indicator for me that, hey, I'm curious what's going on. But to answer your question specifically about AI and how this happened to me, and this came out during our press interview that we did a couple of days ago, I've had a very unique experience being in the military. And I think that really is probably one of the defining reasons for why the trajectory of my career has gone a particular way, probably in a way that, many others, probably just wouldn't have had that opportunity. So I joined the Navy after medical school, which is very unusual, a lot different.
Reverse.
Reverse, right? So that already set me up to have a very unique career. Having said that, deployed, went around the world, been to many, many different countries, etc. Had the opportunity to serve in our two big campaigns over the last couple of decades in Iraq and Afghanistan. But I also had an opportunity to go back to school. And I think that's a consequence and sort of because of the incentives that exist in the military to constantly evolve and learn. And in each one of those stages, I learned something and I was curious about making a connection to my field of work in thoracic surgery. And very early on, I learned about the electronic health record for the VA and the electronic health record for the military treatment facilities. And I wrote a thesis on that. And so I did a deep dive on how those things came about. Why did they come about? And capturing that information to me was sort of like the ground floor of entree into AI. Fast forward a few years later, I'm working on an MBA and I see health information technology all around me. And I'm seeing in my own profession of thoracic surgery, how thoracic surgery has been influenced by the use of technology. We are able to stop the heart, do heart transplants, do all kinds of amazing things because of technology. If it wasn't for technology, we wouldn't be able to do the things that we do. So it was never lost on me that technology has always been sort of at the critical and the nexus epicenter from advancing healthcare, especially my specialty. Fast forward again, I have the opportunity, because of my military experience, to go to the National War College. And while at the National War College, I am the only doctor in my class studying national security strategy. And as the only MD in my class, not only MD, but thoracic surgeon who's fascinated and curious about technology, who's done all this work in electronic health records, who's done a deep dive on the genesis of where this all came from, who's always making connections and connecting dots, I'm also surrounded by brilliant tacticians, brilliant folks in the intel community, and folks in the military who have always used data to inform strategy. And I have access to these folks, and I have this opportunity to work with some of the brilliant people in this domain who are looking at AI and seeing how AI is impacting national security. And my curious self and my making the connection say to myself, hey, and I convince others to sort of see the connections as well, that AI is actually going to make a big difference in healthcare. And there were examples about that. And so I had an opportunity to spend a lot of time during my studies there to do a thesis on artificial intelligence and military medicine.
Wow.
And here's probably the final thing that I think places me in a very unique category, but also in sort of this space of just being so fortunate to have an insight that probably would not have come had it not been for the collection of all of these experiences. And that is this. I'm also a big, big fan of history, and I just really believe that there's a lot to learn about the present and our future by studying history. And if you think about historically the impact that the military has had in healthcare, it's really phenomenal. And it's somewhat disconnected from the civilian sector. I don't think that people in the civilian sector appreciate how much advances, how much innovation has actually come from the military. And unfortunately, sometimes through the campaigns of war that have brought around these innovations and these advances. And so I looked at AI now as an extension of that. So let me go back and give you 3 quick examples. Vaccines. It was George Washington's Continental Army that introduced this concept of vast and mass inoculation. George Washington lost many of his friends to smallpox. And so he was very aware of the scourge of smallpox. And he mandated that the people in the army, the Continental Army, have varicalization, which is a sort of primitive way of inoculating and vaccinating people with smallpox. So they would take the pustule from someone who had smallpox and then introduce it to a person who didn't have it.
Wow.
So that they could build immunity. And I think that was one of the decisive things in the Revolutionary War, because the folks from the British were not practicing that. So you take that now, you fast forward, vaccinations have been a staple in the military ever since then. public health issues, disease, and illness actually have killed more people in the military than guns and bullets.
Right.
So public health is really important. So that was really critical to me, and I saw that. You go a little bit further, I talked about Lister already and how, he happened to be a British surgeon in the army in the UK. And you think about him introducing this concept again, probably because of the exposure he had to war and things like that, to see how important this was. So that you could probably trace antisepsis to, again, this military experience, this military surgeon, and say, wow, that made such a big difference in healthcare. Go to the Civil War and you have the first blood transfusion being done in the Civil War, after an amputation. And that led to the Army's blood banking initiative, which became the reason and and gave us the ability to really be able to store blood, gave us all of those foundational, very important processes to be able to store, keep blood, and then give blood to people that needed them, life-saving blood when they needed it most. That all came from the Army. So you see all of these different stages throughout history of where the military has had a great impact on advancing healthcare. And so I kind of looked at my experience over the last couple of decades, in the last 7 years in particular, being at the Joint Artificial Intelligence Center, the organization that the Department of Defense established to advance and leverage AI for the Department of Defense, being right now in the era, sitting in the time and space of history, and saying, wow, we're going to look back and say the military actually introduced a lot of what we are now looking at in terms of AI and its impact on medicine. And I'd like to, say that it was just a great place to be at the right time to be able to witness all of this. So I think that's the reason why, I have this unique perspective and outlook on all the things that we just talked about.
That's awesome. Thank you for sharing all that. And let's try to end on a high note, because a lot has been said about AI will be the end of us all. I mean, thanks to James Cameron's Terminator, and everyone keeps talking about AI is going to end us. You're obviously deeply connected with the military. I'm sure you have a lot of friends in the military. What is the vibe amongst you and your colleagues about the idea that AI will be the end of us all? Please end on a high note for us, if you
mind, Dr. Tetteh. I will. I'll end on a high note. And so I just retired from the Navy. I did 25 years of service. It was, like I said, very consequential. I've spent half my life serving in the military and the Navy in particular. It's been one of the best experiences of my life. And again, being curious, being a student of history, having these very unique experiences that gave me all this insight. I will say this about AI. And I do believe this is true, because this has been said in different ways about other technologies that have been introduced into society. If you think about electricity and make that comparison to where we are right now, we're turning another century, so to speak. AI is the general purpose technology of our era, meaning it will impact everything. It will impact everything. That general purpose technology permeates everything. Communication, marketing, banking, you name it, entertainment, healthcare, of course. It permeates and will permeate everything. And I predict, and you can already see it happening because of those 5 super forces, AI will impact and change everything as we know it, except the things that matter most.
And what do you mean by that?
What do I mean by that? The things that matter most are your family, the relationships you have with people, spending time with your loved ones, caring about another individual, all those things that are really important about healthcare, believe it or not. When you're suffering, when you're ill, when you're sick, all of the bells and whistles, all of the things that are going on that we brought to bear in this great society of ours with technology, those don't matter as much as someone knowing on the other side when they're ill, when they're vulnerable, that the other person there cares about them. AI is not going to be a factor in any of that. AI is not going to be a factor with, how you treat your fellow human being and your other colleagues. And so I think people have to have that perspective. Electricity, we've been able to live without it. It's an inconvenience when it goes out.
Oh, yeah.
But even in the dark, we can share stories. We can experience each other. We can still love each other. We can still care for each other. And I think that's what I mean by that. When I say that it is our general purpose technology of our era, it will change and impact everything except the things that matter most. Those things are up to us.
And Skynet will not be building Terminators that wipe us out, right?
I don't know if that happened in our lifetime.
Well, boy, I don't know. I don't like getting on that note, but anyway, his name is Dr. Hassan Tetteh. Doctor, if folks wanted to reach out to you, find out more about you, where would be the best place to look?
Tetteh.com is the best place, my last name.com, and you'll see all of our projects there and ways to get in touch.
Awesome. Thanks, Doc. I appreciate it.
Yeah, thank you.
And that's it for another episode of the Forbes Books Podcast. Don't forget to hit subscribe. That way you'll get new episodes as soon as they're available. And if you have a spare moment, I would greatly appreciate it if you could leave a review, which would help other exceptional entrepreneurs like you discover the show. You can always connect with me on X, LinkedIn, and Instagram at Joe Partavilla or on TikTok at J Partavilla. And please don't forget the golden rule and treat others as you want to be treated. Thanks for listening. Until next time, adios.